Well, it is 1 o'clock on the dot, so let's go ahead and get started. Thanks to all of you who are able to join us today. I'm Kelly Allen. I'm the director of the West Virginia Center on Budget and Policy. Our organization, along with Cabin Creek Health Systems, West Virginians for Affordable Healthcare, and West Virginia Citizen Action Education Fund, are hosting this briefing today to raise the alarm that West Virginia is facing a major crisis on top of the pandemic and the recession that we're in. 1 week after the election, the Supreme Court will hear a case that seeks to overturn the Affordable Care Act in its entirety. This case is happening in our state's name, as our Attorney General, Patrick Morrisey, has signed us on it as plaintiffs in support of overturning the healthcare law. Those of us who are hosting this briefing have been talking about the possible consequences of a negative court decision that overturns the healthcare law in terms of disaster preparedness. And we think that's how everybody, families, healthcare providers, our local, state, and federal elected officials need to be thinking about this lawsuit as well. Today, we're going to hear from experts and impacted individuals on what the individual, community, and economic impacts of the court overturning the ACA would be. So just as to the format for today's briefing, if you have a question for a speaker, please type it into the Q&A box that you see at the bottom of your screen, and we will pause between each speaker to take 1 to 2 questions. And then at the end of the planned program, if there are any members of the media on today, we will promote you to panelists so that you can ask any questions that you have of any of our speakers live. And with that, I am going to go ahead and turn it over to Jessica Ice, who is the Executive Director of West Virginians for Affordable Healthcare.
Thanks, Kelly. As Kelly said, I'm the ED of West Virginians for Affordable Healthcare. We exist to bring a consumer voice to healthcare policy. And so what I wanted to do is sort of set the stage for what this lawsuit means, and then, couch it in what it means for West Virginians. So the case, it's known as, at this point, as California v. Texas. And what it hinges on is a part of the Affordable Care Act known as the individual mandate. So that's the provision that used to require people to have a minimum level of health insurance coverage or face a financial penalty. So this was one of the very first parts of the Affordable Care Act to be played out in the courts. The Supreme Court upheld that the law was constitutional in 2012 under a case because the Supreme Court said that the Congress has the power to tax. Therefore, this law is constitutional. So then fast forward about 5 years to 2017, and we're now with a Republican-led Congress who are, for the first time since the law was passed, able to make some changes to it. So what they did was they ended up eliminating the financial penalty that was associated with the mandate as part of a tax reform package. So they said, the mandate itself now carries 0 penalties under this new package, which is good and fine, and everybody was fine with that. But then what happened is that the plaintiffs in this upcoming Supreme Court case say that since the first case in 2012, the Supreme Court upheld the law as constitutional because of the ability and the powers of the Congress to impose a tax. Once they zeroed out the tax in 2017, the argument is that the entire law is invalid since the government can no longer impose this tax, because without a financial penalty, there's 0 tax dollars. So that's where we're at right now. It's convoluted, it's all sorts of legalese, tricky, but it boils down to this, ability to tax, what is a tax? Are we taxing? Should an entire law be thrown out because we don't have tax revenue coming out of it? So on November 10th of this year, 1 week after the election, the Supreme Court will be seeing the case California versus Texas. The part of it that they are challenging is that part about whether or not this is a tax, what does a tax mean, et cetera, and all of those legalese. That's pretty complicated. So what could happen is what we need to concern ourselves with. So whether they overturn it or not within that legal system, the impacts of it being overturned is what we're concerned with. What would happen, particularly in West Virginia, if the ACA was ruled, especially this little tax piece, if it was ruled unconstitutional, what would happen to our health care in West Virginia? And unfortunately, the outcomes of a ruling is not very clear. For one, the court could choose to not necessarily throw out the entire ACA, but they may keep some parts of it, or the law could disappear in some states, like the ones that are challenged in the ACA, like West Virginia is, and not in others. So we really don't know what could happen. It's a bit of a gray area, but regardless, there would be multiple unfortunate impacts. First of all, millions of people, and I believe all the experts are on agreement on this, millions of people would lose health insurance if after November 10th, the Supreme Court ruled it unconstitutional. But here in West Virginia, two things are, I think, especially important. One, without the ACA in place, protections against the estimated 700,000 to 800,000 West Virginians with pre-existing protections, with pre-existing conditions, could potentially lose those protections. The protections are threefold. They are, you can't be denied insurance, which I think we all know very well. But there's two more. There's that you cannot be subject to lifetime caps on your care, and three, that you cannot besides being denied coverage altogether, you can't be charged more. So there's a lot of disparate impacts that could come out of any ruling that comes down from the from this case as it impacts pre-existing conditions. So we know pre-existing conditions prior to the ACA, they could be anything. They could be high blood pressure. They could be diabetes. They could be even having tested positive for COVID as a pre-existing condition. Here in West Virginia, it's not just the conditions we have, but the jobs we hold too that we could see not covered. So we've got a lot of emphasis on coal mining in this. If you were a coal miner, you could be denied coverage. If you were a steel worker or an EMT or anything that an insurance company thinks carries too much risk for the profit they'll receive, can be classified as a pre-existing condition. So the second thing I wanted to just touch on real quick before my time is up is Medicaid expansion. I know I'm the timekeeper and I'm taking all the time, but I just wanted to say that there's about 150+ thousand West Virginians working West Virginians who rely on expansion of the ACA and therefore Medicaid expansion to provide their health insurance. So ultimately, this can impact. I can't think of very many sections of West Virginia that this wouldn't impact. So it could be, and you know, and the ACA, last thing before I pass it on, the ACA brings millions of dollars to West Virginia's economy for healthcare. It keeps our rural hospitals open. It keeps our people covered with health insurance. It pays for our prescription drugs. So if the ACA were overturned, I could honestly say that would be devastating for West Virginia. So that's the landscape we're working at.
Thank you, Jesse. And you smoothly answered the question that I was going to present to you in your remarks. So thanks so much for that. And next up, we are going to hear from the president of the United Mine Workers Association, Mr. Cecil Roberts.
Well, thank you. I'd just like to take a moment to try to characterize the environment we find ourselves in here and how ironic this is. We've talked a lot about this at the AFL-CIO Executive Council, Executive Committee. Every union in the country is looking at this problem. But here's where we find ourselves. We are in the midst of the worst healthcare crisis in the history of the United States since 1918. 220,000 of our fellow citizens are no longer with us. Most have died since March. The experts tell us that we may have another 200,000 of our citizens die. Now, if that alone doesn't tell you something, I don't know what does. We are also in a situation where approximately 8 million of our fellow citizens have been ill from this virus. And there is no short-term answer here. This is not, as some people say, just going to go away one day. It's just like magic. We'll get up one day and it won't be with us. Anyone with a little bit of common sense knows that we are months away from getting this under control. And what I mean by that is the experts tell us that perhaps by the end of the year, there might be a vaccine available. But there are doctors here that will tell you that once that vaccine is made available, we're talking about months and months and months before the general public can see a benefit of that. So think about this. The pandemic, the worst healthcare crisis since 1918, has done something else. And what is that? It has created the worst economy that we have seen in this country since the Great Depression. And I'd just like to mention a couple points about that. There are literally millions and millions of people out there who have lost their jobs. What else did they lose when they lost their jobs? They lost their health care. I'd like to use one example here, if I might. HERE is one of the fastest growing unions in America. They had like 300, 400,000 people when this pandemic hit. Do you know how many people they lost? Every single one of their members. Every single one of them, because they represent people who clean the hotels, make your beds, cook your meals. Some of the poorest, lowest paid union people in the country, but they had health care. Now, overnight, 300,000 people lost their health care. In the airline industry itself, if something doesn't happen soon, we're going to see layoffs at all these airports and bankruptcies, and hundreds of thousands and more people will be without health care. So we've created this terrible economy because of the pandemic. And just something that hits close to home in West Virginia, there's been a 40% Just think about that number. 40% reduction in the amount of coal being utilized in this country because of the pandemic this year alone. This is probably the worst year for coal since going back into the 30s as far as the utilization of coal itself. So we've got people laid off everywhere. We've got people without health care because of this pandemic. We got people who are sick. We have thousands of people dying. And we've got a group of people, I want you to think about this, who thinks it's a great idea to go up and ask the Supreme Court of the United States of America to cut off health care for 20 million more people. Now, if you talk to any of these people, this is what they're going to tell you. Oh, we want to replace this with something better. I want to tell everybody something that we should be aware of here. There is nothing pending in Congress as we speak to replace the Affordable Care Act. People who lose their health care because of the Supreme Court actions will not have health care. And we all know that. And if anybody says, well, it's all going to be better, it's not going to be better. I want to point out something, and I don't mean to get on my high horse here, but I can't help myself. And, you know, that's why you invited me here, and it's your problem. So, so it took 200 and some years to pass the Affordable Health Care Act, right? Now, there are people with insurance walking around with a job saying this has nothing to do with me. That's not true. I'm also on the board of directors at the Cabin Creek Clinic. The Cabin Creek Clinic was founded by coal miners. And because you don't only need an insurance card, you need access to healthcare too, right? You've got to have a place to go that's convenient. So coal miners built a clinic on Cabin Creek, and that is now expanded to 6 locations throughout Kanawha County. But here's the thing, if the Affordable Care Act goes away, 35% of our income at the Cabin Creek Clinic goes away also. I want to point something out here. Not only do we have 6 locations, but there are 24 other clinics throughout the state of West Virginia that do the same kind of service that we do. And that those totals gives us about 100 sites, when you count Cabin Creek in there, where we're providing services to the most rural areas of West Virginia. So we're going to lose 35% of our income. And that's going to tell us what? We're going to lose some of the people who work at these clinics. So the people who lives up and down Paint Creek, Cabin Creek, Logan County, Boone County, McDowell County, places like that, they are not going to have access to a place to go for healthcare. So let me just say this. And I could talk here for another 3 hours, but the key here is this. We have millions of our fellow citizens about to be evicted from their homes. They're gonna be homeless. So we're all straight about that because they cannot pay their rent. We are going to see more people lose their jobs before the end of the year. More people lose their health care, and the more people lose the ability to just exist in this country. And Congress can't figure out some way to help those people. And people are telling us what? Don't worry about this. We'll pass something better in Congress. I deal with Congress a lot. It is hard to push something through Congress. It's almost impossible. So what we're facing here is the possibility of losing health care for 20 million people, of our fellow citizens. And there's one study from a very respectable organization in Massachusetts that says if 20 million people lose their health care, 41,000, 42,000 of those people will die every year. Now think about that. Congress is people are actually asking the Supreme Court to do this. This is an asinine thing. I can't think of a good word without cursing, but I'll just say it's stupid. Okay.
Thank you, Cecil. I always knew that, you know, he would be a great speaker from my time knowing him with his work with the mine workers. So Cecil is super important to West Virginia. We appreciate you a lot.
Thank you.
Thank you, Cecil, and thanks for bringing in the how housing and food security and healthcare, all these things play together. And without one, you know, we know folks' health is seriously impacted. So all of this is definitely so linked. And next up, we are going to hear from a physician's perspective on what the ACA lawsuit could mean with Dr. Daniel Doyle.
Well, good afternoon, everybody. I'm speaking to you today from that health center on Cabin Creek that Cecil was just talking about, Cabin Creek Health Center at Dawes, West Virginia. And I've had the privilege of working here with the staff here for the last 10 years. And in addition, I've worked at New River Family Health Center just down the road in Fayette County for over 40 years. I want to say I really appreciate those of you who have turned out to spend some time with us today, especially members of the media, because it's so important that we inform healthcare providers, because believe it or not, many care providers don't even realize that the carpet is about to be pulled out from underneath them. And also the general public about what is really a looming crisis in healthcare, as you've already heard. In my 40 years practicing, the first 30, it was my experience that so many of my patients and our patients experienced low income and other social factors like transportation, housing, or nutrition that contributed to the poor health that they experienced. And one of the biggest things over 30 years was that people did not have health insurance. That was one of the social factors I saw day in and day out for people not getting necessary medical care. I literally saw people die because they couldn't get a special heart test or get cancer treatment. There's a lot that we can do at Cabin Creek Health Center and New River Health Center. People can get in, but sometimes they need some special things. A CT scan, a stress test, a cardiac catheterization, cancer treatment, an orthopedist. And I was seeing people who weren't able to get those things because they didn't have health care. They didn't have healthcare coverage. Every hour of every day, I had people who couldn't get those special tests or scans or specialty care. And as you heard Cecil say just a minute ago, it's been calculated that 40,000 people a year die in this country for lack of health insurance. That really changed in 2010 with the passage of the Affordable Care Act. Now I could go for days without having patients who missed necessary tests or specialty care. In fact, it had been routine for people to not get what they needed. The new routine was that people did get what they needed. And that's made all the difference in trying to practice in a place like Cabin Creek or Fayette County, West Virginia over these past 10 years. The Affordable Care Act isn't perfect. It still leaves around 10% of Americans. That's 27 million uninsured. And that number has been rising. So we need to do better. But to go backwards is unthinkable. As Cecil said, it's, well, asinine. And as Kelly Allen said earlier, and Jessica, there's now this case before the United States Supreme Court asking the court to completely throw that out. In West Virginia, it would mean that 200,000 people at least lose their health care coverage. 18 state attorneys general around the United States, believe it or not, have signed on supporting that lawsuit. And unfortunately, that includes West Virginia Attorney General, our Attorney General, Patrick Morrisey. So I'm one of 60 West Virginia physicians, 90 healthcare professionals in all, who sent a letter to Attorney General Morrisey in September, pointing out the harm this will do not only to healthcare coverage for 200,000 West Virginians, but to the West Virginia economy as a whole. More rural hospitals and physician practices will close. Already some have due to the pandemic. More jobs will be lost. And state and local revenues that provide all kinds of things, including education, are estimated to decline around $480 million if Mr. Morrisey and the 17 other attorneys general succeed in their case to get the Supreme Court to throw out the Affordable Care Act.
30 seconds, Dan.
Yeah. I'm sorry?
30 seconds.
Okay. So we've asked Mr. Morrisey to take West Virginia out of this lawsuit. We've asked him to meet with us and discuss the problems this will cause. So far, we've had no response, and we believe he owes the people of West Virginia an explanation for why such a frightening policy would be proposed and pursued. So again, we're asking on him and all elected officials in our state, starting with the Justice Administration, to tell us what plans they have for guaranteeing health care for West Virginia citizens if the Affordable Care Act is thrown out by what will be a realigned United States Supreme Court. Again, thank you for being here.
Thank you,
Thanks,
Dr.
Dr.
Doyle.
Doyle.
Okay, and next up, we're going to hear the perspective from two speakers on the Affordable Care Act's Black lung benefits and what is at risk through the court case as to those benefits. So welcome Mr. Jerry Coleman and John Klein.
I am a lawyer who represents minors and widows with federal black lung claims. And Jerry Coleman is a coal miner disabled by black lung and president of the Kanawha County Black Lung Association. And Jerry and I would like to point out that in addition to the critical healthcare provisions that hang in the balance, there are also two provisions of the Affordable Care Act that are equally important to coal miners disabled by black lung, to their surviving widows, and to the economy of West Virginia. One is a 15-year rebuttable presumption that says if a coal miner has a totally disabling breathing impairment and at least 15 years of qualifying coal mine work, then the miner's pulmonary disability is presumed to be caused by the long-term coal mine dust exposure unless the coal company can prove otherwise. It's a rebuttable presumption. The other is a provision that widows of coal miners disabled by black lung are entitled to coal mine black lung benefits without having to endure years of litigation trying to prove that the black lung disease hastened their husband's death or the miner's death. And to illustrate this, Jerry, you worked in the mines for 37 years and became too short of breath to continue in 2007 at the age of 57. So your claim for black lung benefits should have been a pretty straightforward process. But maybe you could share a little bit how the reality of that was.
You know, it took me actually 10 years to get my black lung, but if it wasn't for the affordable black lung, the 15-year presumption that I had helped me get my black lung. If it gets took out, you know, we're going to be in bad shape, but we're going to have to stay with it. And black lung is a serious thing to all the miners. You know, it gets to the point that it just takes things away from you. It deprives you. And you know, the 15 years you gotta have.
So Jerry's claim took 10 years to litigate, and without the 15-year presumption, he would have had the burden of proving that his 37 years of exposure to coal mine dust contributed to his disabling pulmonary, totally disabling pulmonary impairment. So Jerry, in addition to that provision, what would happen to the benefits for your wife and children if something happened to you without the ACA to protect?
Yeah, if they took these provisions away that's in there now, thank God it's in there now, that my wife, if something would happen to me now, my wife would be taken care of and she would still receive my benefits. If the Affordable Care Act gets replaced and this is took out of it, my wife would have to refile again. And the cause of death, if I was in a car wreck or something and I got killed, and whichever doctor or whoever filled out my death certificate, and if he didn't put black lung was the cause of death, my wife couldn't get my benefits. So that's why we need the Affordable Care Act.
That's a very important provision. Without that, widows were losing their benefits and going through years of litigation trying to get coverage at a time when they'd lost their husband and the income. And Jerry, and when a coal company declares bankruptcy, who ends up paying the monthly benefits and medical benefits to disabled miners who work for that company?
The Black Lung Trust Fund pays for the medical and
And the monthly benefits.
monthly benefits.
And do you know how much money that brings into the state of West Virginia?
It brings $41 million a year. In 2019, we paid $41 million into the state of West Virginia.
And the $41 million coming from the trust fund that Jerry's talking about does not include the claims being paid by coal companies and their insurance companies, which would be a much higher figure. And I tried to do some calculating, but the statistics are confusing, but it would be at least a 9-digit number in addition to the 41 million coming from the trust fund. And another point about the Affordable Care Act, going back to the 15-year presumption, is that the approval rate went from 19% to 31% now, an increase of 12%. So the impact, as you can see, would be horrendous if we lose those provisions. And that's all we've got. Thank you. Unless, Jerry, did you want to add anything else?
The only thing I got to add is that Cecil knows it, and a lot of them knows it, that at the end of December, that our funds will be cut in 50% on your tons on coal.
The
Yeah.
excise tax. Yeah. And
And it
that's
will,
what support.
from $1.10 to 55 cents a ton underground, and it goes from 50 cents to a quarter on the strip mines. And, that's a lot of money to lose, when you're paying out $41 million, for your severance tax.
Thank you.
Mr. Coleman and Mr. Klein, thank you so much for sharing. And Mr. Coleman, thank you for all you've done to power West Virginia and the nation. And it's just such an important reminder of how wide-ranging the Affordable Care Act is, and how many provisions, are part of it and are kind of baked into our system now that it's hard to imagine losing. We're going to pivot to another important piece of the Affordable Care Act right now, and that is substance use treatment and opioid recovery. Many folks were not able to access these sorts of treatments prior to the Affordable Care Act. So we're going to hear from a trio on this section, Dr. Carter, Dr. Josh Carter from Cabin Creek, Bailey Hendricks, and Sheila Winter.
I'll go ahead and just introduce the program real quick and kind of how ACA has helped us expand and offer more treatment, and then hand it over to Bailey and Sheila about how it's helped them. So the big thing is I'm the substance use treatment director for Cabin Creek, and we started our substance use treatment programs back in 2017. At that time, we had one group with maybe 12 patients in there, and with the expansion and more money coming into that, we've been able to, at this time, we have 13 separate treatment groups at 4 different sites. Originally, it was just one. And then we have over 100 patients at this point, with the vast majority having a large number of positive changes in their life, all the way from seeking education, improving relationships with family, work, owning their own homes, anything like that. And then Sheila and Bailey are with me today. Bailey's actually employed with us now. She was our very first person in treatment ever. And just so they can talk about how without the expansion, none of the things they've done or are going to do would be possible. I'm going to hand it over to Bailey first.
Hello, I'm Bailey. I am also an employee of Cabin Creek. I'm the recovery coach, but like Josh had said, I started out as a patient. So obviously it would be pretty devastating if the benefits got taken away, because I would have never been able to be in the recovery program that I was in to make all the life changes that I made to get as far as I have in my life, to allow me to be where I'm at now, which, I have a full-time wonderful job. I'm in college now. I'm trying to become a therapist. I'm trying to give back all the things that this wonderful place has been able to give to me. So, you know, if those things go away and we're not able to continue to do those for other people, it's going to have a devastating impact on everybody that we're helping right now, because they're going to be forced back out into the streets. I don't want to take up too much time talking. I would like to turn it over to Sheila, because she has a wonderful message. So Miss Sheila, take it over.
Thank you, Bailey. My name is Sheila Winters, and I started this program 302 days ago. As of this time, that's how many days clean I have. And without this program and without the funding for it, I could be dead. The people there, you know, they have positive reinforcement. Anytime you need them, they're there. And if this gets taken away, there is going to be more addicts, but nowhere for treatment. We need these places like this, because the people that are there, they do give you positive reinforcement. For me, myself, where I have as many days clean that I have, I'm starting into college because I want to give back what has been coaching for years for addiction. And the main thing that people don't realize is that addiction is a disease. It, you know, it starts out with opioids, and then from the opioids, it moves on to the harder stuff. And if you don't have places like this, then people are just out there wandering around. They're going to end up dying even more than what deaths that we've already had. So in my opinion, with these recovery places that we have, there is more money that needs to be put into this. Because if we don't have them, like I said, there's going to be more problems. And for me, I know that myself personally, I probably would be dead today without this program. Anytime that I have called, there's always been somebody there to talk to me. There's always been somebody there to give me reinforcement. And everybody thinks that you're just trading one drug for another. You're not. With this program and the medication that is provided for us, it helps you to regain your life back. You regain things that you thought were lost. As far as me, I have lost a son to this. And that is a very hard thing, because I couldn't get him into a program that I'm in. And if it had been available for him, then he may be alive today. So I want to fight even harder to keep this going, so that I don't have to see somebody else die, so that maybe I can give back to them, so that I can help somebody else, so that they know that at least one person cares. And if we lose these programs, like I said, we're not going to have that. We're not going to have that at all.
Sheila and Bailey, would you mind speaking on, both of you mentioned a couple of times about how it was so hard to find a program before, whether it's from your own experiences or other people we have in the program, people you've talked to. What were some of the reasons, whether it was financial, stigma, the reasons it was harder to get into a program prior to this and prior to the expansion?
Well, for me, it was my insurance. There was nobody that would take me because of, you know, the insurance. And when I had searched for 2 years to try to get into a program. And like I said, nobody would take me. And then when I called the Cabin Creek clinic, I had talked to them, and they said, yes, you know, that they would take me. But if it hadn't been for them, I would not be in a program today.
Absolutely. You know, you would get all these empty promises of put on these wait lists that you would never hear back from these people about, that, you know, were months and months long, or probably never even existed. Or people would stigmatize you so bad that, and judge you, that you know, you probably never even got past the phone call. You know, they just would make you feel like you were worthless and waste of their time, and then, you know, hang up on you. And then, like Ms. Sheila was saying about the insurance, you know, most places were cash only. So you had to be making bank, or, you know, have some kind, or be going out of state essentially to be, to have access to it, basically. So it was just, it was very difficult. And if that's what we're going to be going back to, you know, it's not going to be pretty.
No, it's not going to be pretty at all, because if we have to go back to that, you're going to see more robbings, you're going to see more killing. You know, these people are going to go back to the hard drugs. Their kids are going to suffer from it. The families are going to suffer. Without these programs and the things that they're doing for these people, it's just going to get really bad all around.
Just
So-
kind of, oh, go ahead,
Oh,
Sheila.
go ahead, Josh. I'm sorry.
No, you're
Go
good.
ahead.
I was just gonna kind of say, to end it with kind of where we're at in the world right now. A couple of people have mentioned how bad it would be with the pandemic going on, and you know, there's a lot of reports of things happening already, but also in the future with increases in mental health issues, and we have doses, increases in substance use, and you know, without having the treatment available, that spike and all of those issues are just gonna be even worse going forward if we don't have the expansion to help offer that treatment.
Thank you so much, Dr. Carter and Ms. Sheila and Ms. Bailey. You know, several of our speakers have talked about, you know, real life and death implications to this. And I hope that's one thing that folks take away from this, although I think, you know, we all know what the consequences are. My job is to kind of share the bigger picture now of what's at stake. So I'm going to just go over that for a couple of minutes. You know, if the Supreme Court overturns the Affordable Care Act, it's going to impact all of us, not just folks who are directly covered due to it. The consequences are going to touch every family in West Virginia because of this really inextricable link between our healthcare system and our state's economy. We saw new data come out this week that suggested that our state's uninsured rate would nearly triple if the ACA is overturned by the courts. That would be 198,000 new West Virginians losing their health coverage right away. Today, our Medicaid expansion enrollment is higher than it's been since 2016 because the recession and the resulting job losses, as some previous speakers have talked about, have meant that folks need coverage. They need health coverage that isn't tied to employment because we're in a recession and lots of folks have lost their jobs right now. Tripling our uninsured rate would be disastrous anytime, but it's unthinkable when we're still facing the impacts of the COVID-19 pandemic, and we will still be facing them when the Supreme Court's decision comes down. With those 198,000 people who would lose their coverage, we know that the losses would disproportionately harm our state's poorest counties, those counties that are already struggling with loss of coal and other industry jobs. The repeal would also disproportionately worsen health coverage among our Black and Hispanic residents. And there's a chart there just showing how much the uninsured rate would spike among communities of color. And this is a big one, the last bullet on here. Uncompensated care for hospitals and healthcare providers would skyrocket. When the Affordable Care Act was implemented, uncompensated care, which is the cost to hospitals of taking care of folks who don't have health insurance and can't pay their bills, which hospitals basically have to figure out how to absorb, that went down in West Virginia by 69%. And overturning the ACA would mean that uncompensated care would increase by $1.6 billion over 10 years. We also know that rural hospitals in states that didn't expand Medicaid are about 70% more likely to close. So if the ACA were overturned, we would see all these states that did expand Medicaid would suddenly see hospitals 2/3 or more likely to close. And of course, if your local hospital closes, the ACA repeal has impacted you, whether you were covered through the Affordable Care Act or not. You're still at risk of losing access to health care if local hospitals and healthcare providers aren't able to stay in business. And then above and beyond the healthcare costs, we're looking at major, broad, statewide economic impacts of ACA repeal. If the ACA is overturned, an estimated 16,000 jobs just in West Virginia would be lost. And you can see that nearly half of them are in the healthcare sector, but we'd also have all of these indirect job losses in construction and retail trades and insurance and other industries. And I think that was a question somebody asked, like folks who are covered from health insurance through the marketplace and through Medicaid expansion, folks work for those companies that are providing health insurance. And 16,000 jobs, just to put that in perspective, that's 1 out of every 50 jobs in the state. That's a major, major economic impact. And you know, the reason for that is because folks that work in our healthcare sector, federal healthcare dollars that come into our state, they are used and spent on groceries and buying cars and lots of things that really power our economy. And for the same reason that repealing the ACA would impact jobs, it will also impact our gross state product, and that is the monetary value of goods and services produced in our state. Overturning the ACA would reduce our gross state product by over $9 billion over 5 years. And due to spillover costs, it would cause a loss of $16 billion in business output over the same time. And the bottom line here of talking about this is just to say, even if you're not someone who's directly impacted by the loss of coverage or the ACA being repealed, even though you probably are, you're still going to feel these rippling effects that impact our entire state economy. And then, of course, as the economy goes, so goes our state budget. The loss of jobs and economic activity due to the ACA repeal would reduce our state and local tax revenue by about $350 million over 5 years. We also talked about how much federal money that the Medicaid expansion brings into our state. We would lose over $1 billion annually in federal healthcare dollars that pay for the costs of the Medicaid expansion. And then the state would have all these additional costs that would fall back on to us. We would have children who are on the Medicaid expansion shift back onto CHIP. We'd see increased costs of uncompensated care, like we already talked about. And then we'd have folks who are going through substance use treatment and recovery and all these other needs that wouldn't have this federal support that they have now. And the state would have to, you know, figure out how to cover all of these folks. And then just to throw it out there, this is all happening when our state was already facing a tough budget picture next year. We were already, even before the COVID-19 pandemic, we were facing $170 million budget shortfall in fiscal year 2022. So just think about what taking $1 billion in federal healthcare dollars out of our state budget would mean when we're already in a pinch. And, you know, I just say all of this to say that the potential individual, community, and economic impacts of repealing the ACA would be devastating for our state anytime, but amid this recession, amid this pandemic, it's truly unthinkable. And I do have to add that there would be winners, because you might be wondering, what is the point of this lawsuit? And the vast majority of us would be losers, but the wealthiest 1/10 of 1% of Americans would get a yearly tax cut if the ACA is overturned of about $200,000 a year. So just wanted to throw that in there. So what can we do? I think we're all here to take action today. And this has been a really broad overview of what's at stake. And we hope that if you're an impacted individual, if you are an organizational partner, if you are a healthcare provider or an elected official, we hope you will adopt this mind frame that we've been talking about around disaster preparedness. And that's how we're coming at this crisis. So if you want to take action today, you can sign on to the letter that was mentioned earlier, calling on Attorney General Patrick Morrisey to withdraw West Virginia from this lawsuit that's happening in our name. And I think Jesse is going to put the link in the chat now for folks that want to fill that out. I think you should also consider that the U.S. Senate is currently considering a nominee to the Supreme Court who, if she is seated in time for the November 10th hearing, could be the deciding vote in the ACA repeal or lawsuit case. I think it's really important that our U.S. Senators Joe Manchin and Shelley Moore Capito are aware of the stakes when they cast their votes. So please think about calling them and sharing with them how much the ACA, the Medicaid expansion, Black lung benefit, substance use treatment, and all of these provisions and protections have meant to you and your family. And for folks who are listening who work at healthcare centers, who are healthcare providers, who are local, state, or federal elected officials. It is on all of us to adopt this disaster preparedness mindset and to work to quantify what the loss of the Affordable Care Act would mean for your health center, for the 179,000 West Virginians who rely on the Medicaid expansion, for the 382,000 non-elderly adults who have pre-existing conditions and could be declined for coverage if this goes away. We think that the State Budget Office and the DHHR should publicly be sharing what the impacts of the loss of the ACA would mean for the state budget and the agency budget. We think our governor and our federal elected officials should be drafting contingency plans to ensure that people can still access healthcare and hospitals are able to remain open. I do think it's important to say that the state alone can't replicate the Affordable Care Act. Our governor and our state legislature cannot fix this alone because we don't have the money to replace the ACA's funding, and we don't have the authority to regulate all types of health insurance. But they do have a duty to be planning and relaying to our federally elected officials, who do have the power in all of this, what the consequences would be in our state if this lawsuit overturns the Affordable Care Act. So it's incumbent on all of us to make sure everyone we know is aware of the lawsuit and that we are pressing our policymakers to prepare for what would truly be a disaster for West Virginia if the ACA is overturned.
All right. Thanks, Kelly. I know we may have some questions from journalists, but while we wait for those, let me go ahead and ask some that were opened in the Q&A chat here. Specifically for Dr. Doyle, is black lung caused by anything other than exposure to coal dust? Is there any other industry besides coal responsible for black lung?
The answer to that is no, because the federal black lung law passed in 1969 specifically was passed in relation to coal miners and coal dust exposure. A variety of states in the country, and West Virginia is one of them, have an occupational pneumoconiosis program that does provide benefits for state compensation benefits for other occupational dust diseases like silicosis, asbestosis. But black lung as a disease is a coal miner's disease, and federal black lung laws are specifically for compensation of occupational lung disease suffered and sustained by coal miners.
Okay, thank you. So we know that black lung disease comes from coal mining. It is protected under the ACA. We have Caitlin Cohen from the Gazette who wants to ask a question on the phone. Go ahead, Caitlin. Katie,
Hi.
I'm sorry, my
Can you guys hear me?
apologies, Katie.
Yep, we can
No,
hear you.
you're totally fine. Can you? Okay. Well, first, thanks for having me on today. I really appreciate it. I know this is an increasingly important conversation to be having. And I want to ask, I have two questions here, and I'll just shoot them off first. You know, we're talking about, I can respect and appreciate signing a pledge and coming together to try and stop this, or at least do what you can to organize against repealing the ACA. I wonder, with how politicized the ACA has turned in the last 4 years, perhaps more than the last 4 years, you know, how do you overcome that? It doesn't seem like Morrissey will be willing to even open a letter, much less respond to it against this. It seems like we're pretty set, or at least that side is, in the way that they're going. How do you confront that, and what is the best way that you're getting your messaging out to people that might not be in the weeds organizing like this?
Katie, that's a hard question. I think Kelly unmuted herself. Maybe she wants to take this.
Sure. I mean, I don't think that we have any illusions that the Attorney General is going to change his mind when this is an ideological opinion. But I think that the folks that deal with our health agencies, the folks that deal with our state budget, our federally elected senators, all do recognize the stakes. and there is no alternative. So I think the place that we are right now is really ensuring that folks know the stakes. I'll be honest, I didn't know the extent of the Black lung benefits that were provided in the Affordable Care Act. So I think the more that we can do to make sure folks know how how interwoven that the ACA is into our healthcare system and what a disaster it would be to overturn it is kind of the first step. And I think from there, we just, yeah, like I said, we want to make sure our senators know the stakes when they're voting to seat somebody on the Supreme Court. And we want to make sure that they are aware of what a significant impact this will have on West Virginia if the law is overturned. And we want to know what their plan is.
Yeah, and then one more, and Kelly, it kind of plays off that perfectly. And I don't ask this like I'm going to write everything that you guys ever say, but I do wonder, you know, from our perspective as the media, this is a huge issue within you guys. It affects everything from food insecurity, homelessness, whatever it is. What, in your guys' opinion as the experts, and this is to the doctors, the policy minds, anything there, what is the best way that we can be reporting on this and making sure that people aren't getting lost in the minutia of, you know, healthcare policy, even though that is important, but understanding this is something that will affect their daily lives. If there's any ideas out there, thoughts that you all think that healthcare coverage could be better here, I'd love to hear it.
Dr. Doyle, do you want to jump in? I saw you're unmuted.
Well, I'm kind of still, I'll try to answer that question or give my contribution, but I'm still thinking about the first question in a way and thinking about the work that Cecil has done over the years, that Jerry Coleman, that Craig Robinson, that John Klein. And two words that come to my mind are educate and organize. And we saw it done with the original Black lung movement in the late 1960s and 1969. We've seen that over the past years in the work that Cecil and the United Mine Workers did to protect pensions and have continued to do with relation to the Black Lung Trust Fund. And again, I've heard them say, this isn't something people are going to give to us. This is something that we have to educate and organize for. And I'll stop there.
Could I add something to that? Let me just say this. We're on a short time frame here, obviously, because this is going to be presented to the Supreme Court of the United States fairly shortly after the election. And once those arguments are made before the Supreme Court of the United States, and then it's kind of in the hands of 9 people, right? But here's the thing that I think should happen. And our state is full of examples, and our nation is, quite frankly, full of examples of some everyday average people doing some really unusual things and being successful at it. The one thing we could do is throw up our hands and say that the stakes are too high, people are too powerful. And we've really never done that in our state. I mean, you go all the way back to the Paint Creek, Cabin Creek Mine Wars and March on Bear Mountain and Mate One. People have stood up. And when we started this fight over pensions and healthcare, people looked at me like I was crazy because you just can't do anything about bankruptcy was the argument. And that's true. But we did something about the effects of bankruptcy, right? And we were able to extract money from some very powerful people like Peabody and Arch and Patriot. And then we were able to pass initial legislation in 2017. Then we passed some additional legislation at the end of the year last year. And, you know, fight never ends. If you're a worker in this country, average person in this country, the odds are really stacked against you. But I think people should have to explain, regardless of who they are, why they think this is a good idea. I don't care if it's the Attorney General or anybody else in politics or anybody else in a position of power. Why is it a good idea to eliminate health care for 20 million people in the midst of a pandemic? And the one thing we haven't touched on here that's in the Affordable Care Act, by the way, is the fact that you can stay on your parents' health care until age 26. And there are literally thousands and thousands of kids, if not millions out there, that have health care because of the ACA, and if it wasn't for that, they wouldn't have it. And the basic question is, you know, start at the bottom. Is it better for people to have health care or no health care? I think the answer to that's pretty easy. Then you move from that. So that activism it doesn't bring relief immediately, but it does bring relief at some point in time. And if we just take this lying down, and we're going to be stuck with this. If we lose this fight at the Supreme Court, we have got to be very active here and saying, okay, you've been promising something better, give it to us.
Well, thank you.
I
I know
like to-
that we've reached the 2 p.m. cutoff here, and there are thousands of more words we could say on this for sure. And I also know that there were a couple of questions that weren't addressed during the Q&A. I've taken shots of that, but so I remember. I will absolutely follow up with those who have questions remaining. If you want to email a question to me, you can. It's an easy email address, jessica@wvahc.org. So it's at wvahc.org. And I can certainly address some of those other questions we had in our chat. As folks have probably noticed, I'm a huge fan of our Affordable Care Act, what it's done particularly for West Virginians. And I certainly don't want to see any of that lost due to this lawsuit that's coming out on November 10th. I don't think it's what Americans want. I think Americans want their health care. I think Americans have built this country and deserve their health care. So my job is to say thank you to all of our panelists. I also want to thank everybody who came in and participated and showed up for this session. I think it's vital going forward. I know that in 2 weeks we have an election, and then 3 weeks we will have oral arguments before the Supreme Court. So I have, you know, all the biggest hopes in the world that Americans will show up to vote on November 3rd and at the polls say what's really important to them. And I guarantee one of the subjects is healthcare. So thank you all.
Thanks, everybody.